Welcome to episode number 2 of The Empty Chair, in which I invite you to just sit there and let me tell you what's on my mind. Today, what's on my mind is the ethics of advanced veterinary care. So it worries me that as vet medicine advances, in a lot of ways this makes pet ownership less affordable for people. I'm not saying that vets are overpaid. I think they do one of the hardest jobs out there for not enough compensation. I am saying that the expansion of what's possible in veterinary medicine has made the ethics of pet ownership incredibly difficult. There's one of the pets who's making my life incredibly difficult. We can now do for our pets medically everything we would do for a person. It doesn't cost much less for an animal than it would for a person. The equipment isn't less expensive. The specialists needed to operate that equipment and read results are not less expensive than they would be for a person, which means that if somebody has, for example, 4 pets, which is not an uncommon thing, they potentially have the healthcare cost equivalent of 4 other people living with them. I see people going into debt in the thousands and in some cases the tens of thousands to care for pets. Even if they don't go into debt, the cost of acute illness or injury or an accident can deplete your savings so fast. Most people don't understand the value of pet insurance, or they don't buy it because they don't understand how it works, and they don't realize that although it may have exclusions, it would still cover a lot of stuff. For example, if a dog had documented joint problems that weren't covered as pre-existing condition, the insurance policy would still cover, for example, cancer care or poisoning or an accident. And the value of pet insurance is a topic for another time. I do feel pretty passionately about it, but that's not primarily what's on my mind at the moment. What is on my mind is the criteria we use to make humane and ethical decisions about companion animal care. Some decisions seem obvious. A young dog that ingests a foreign object that can be surgically removed should probably have that surgery and go on to live a healthy life. But what about an older dog who does the same thing? Is the cost and trauma of surgery justifiable for an animal that might have only 2 years left to live? And yet, if that animal's projected total lifespan is 15 years, that 2 years is equivalent to a decade in the life of a person. And so the ethical math becomes really hard to do. And yet, let's say it would cost $5,000 to save that older dog, which is a conservative estimate for that type of surgery. How many shelter animals could be desexed or fed or housed for that same amount of money? Is it ethically better to let a beloved pet go and invest that money in other lives? Or is it justifiable to spend money on an animal that you're attached to? I don't have the answers, but there are a couple of things I feel clear about. One is that I think in the case of chronic illness, vet medicine can and should be more proactive about delineating among diagnostics, curative care, comfort care, and hospice. I think sometimes diagnostics are done when they're not really necessary. If it wouldn't make a difference to the outcome to know exactly what's wrong, then why put an animal through invasive diagnostics in particular, and why waste thousands of dollars doing it? I feel like trying treatments for what would be an obvious condition and seeing whether they work is a logical way to go. This is the theory I've used for my cat Minx, who may or may not have lymphoma. A biopsy might or might not confirm that, but her treatment wouldn't change, and so why put her through it? She does have insurance that would cover it, but I don't feel that that would be an ethical use of the insurance company's resources when a diagnosis wouldn't actually change what her care would end up being. And this is where I think the ethics of pet medicine can become really complex. Whose quality of life are we focused on? Is it the animal or is it us? And I think a lot of people, and I include myself in this category, outsource to companion animals a standard of love and of care that we're missing in our own lives. In a really deep way, investing in saving our pets is a displacement of certain type of self-care. and there's more riding on it than the life of the animal, and perceived failure to save the pet feels like a betrayal of a really vulnerable part of yourself, as we identify so strongly with what we believe the animal's experience to be. So I wonder what it would be like to shift that lens a little bit, to become more fluid with the idea of the death of a companion animal. We expect long lifespans now because vet medicine allows disease management in a way that wasn't possible even 10 years ago. This puts a lot of unfair pressure on people who can't afford that level of care, but who give good homes to animals who would otherwise be in shelters or on the street. How much is enough when it comes to pet care? Desexing, vaccinations, good food, a safe and loving home. Should people have to jump a higher bar than that? Even if they can jump that bar, should they? Is that the right thing for the animal? And is it a truly ethical allocation of resources? These questions are present for me right now because my youngest cat has a non-life-threatening problem that may require extremely high risk and expensive surgery to correct. If she doesn't have that surgery, she'll need to be sedated every couple of months to flush debris and poisonous junk out of her head, and she'll be on steroids and antibiotics that will affect her long-term health. If she does have the surgery, it will be very expensive and could cause permanent neurological damage. 15 or 20 years ago, I wouldn't have been facing this choice. Symptom management would have been the only thing that was available to me. And even 10 years ago, I would have had trouble finding a surgeon to do this type of surgery, which is a lot more common in dogs. So I'm looking at these questions and I don't have an answer. She has insurance, but this may be excluded as a pre-existing condition. I, quote unquote, can't afford this, unquote, but I don't know if that's the right thing to do. I might make a different decision if she were older, but she's barely 5 years old and has a decade of life ahead of her. I can't help thinking of all the other animals or even people that could be helped by the amount I would have to spend on this surgery. In some ways, this would be easier if she had a terminal condition like Minx probably has. I'd do symptom management and then, I'd make the decision when the time came. But this isn't that kind of disease. It'll ruin her life without endangering her life. And the availability of this highly advanced, highly technical and delicate surgery has put me in a position that feels wrong no matter what I do. I'm pretty sure I'll choose the surgery. I'm equally sure that I'll be haunted by the knowledge of all the animals that could have been desexed or fed or housed with the amount of money I'll end up spending on this. I'll always wonder if it was the right thing or a completely self-referential and selfish decision. And that's what's on my mind.